Hi friends, I am Dr. Pratap Singh Rathod. I have done the MD in forensic medicine. In today's video, we'll start with medical autopsy. Autopsy or necropsy means postmortem examination of a body. It is a process of examining a body to determine the cause of death, manner of death, and how the how the person had died. In autopsy, all body cavities are opened, and every organ is examined to find the evidence contributed to the cause of death. Partial autopsies have no place in forensic pathological practice, and every autopsy should be complete. Every autopsy, every organ has to be dissected to know the cause, and partial autopsy should not be done. If autopsy is not done, the exact cause of death, the presence and extent of disease or injury, the incapacitation produced by them, and whether there was any pain or suffering becomes only speculations, and that's why autopsy is required. The autopsy is carried by a registered medical practitioner, preferably a forensic expert. Mortuary attendant usually helps the uh, forensic expert in preparing the body and help the way wherever required, such as sawing the skull cap, reconstructing body, etc. Coming types of autopsy, it is usually has two types: pathological or clinical autopsy and medical autopsy. Pathological or clinical autopsy, it is done by pathologist. The aim of this autopsy is to find and determine the cause of death, the extent of natural disease, or the combination of comorbidities that led to death. And it is also to find morphological changes explaining the signs or symptoms of the disease and the effectiveness of how the treatment is done. So main aim is to determine whether the treatment was helpful or what were the signs, what were the changes occurred because of treatment, and why the person died during the process of treatment. Pathologist has easy access to relevant information, that's why it is advantageous. He also knows about his history, physical condition, course of disease leading to death. He also knows that history directs the pathologist to appropriate ancillary investigations. He can he already knows which organ is mostly affected, and he will helpful for him to determine the cause of death. He can also detect previously unrecognized diseases if it is not detected. It also helps the family to know any some inheritable conditions if the person was suffering from. Some disadvantages often relies on histological assessment, and bias may be there between two individuals. It is only academic oriented, and only academician who wants to determine the cause will do the autopsy, otherwise it is not done. It requires consent of the family, which is a major hurdle in case of this, because many of the family in India will not family members will not accept to do autopsy just to determine the cause of death. Coming to medical autopsy, it is done by forensic expert. It is often in this many time history is absent, and it is very sketchy or doubtful or misleading. In some cases, identity of the person may not even be known. Here, the autopsy surgeon does the autopsy to determine the time of death, age of injuries, also determine the cause of death, manner of death, and mechanism how the person died. If there are any inconsistencies between the apparent cause death and actual findings, we may also visit the scene of crime to determine the what were the what were the situation which led to the death. He may also carry for external examination like examination of clothing, determine the pattern of injuries, the relationship with the object, weapon causing them, and collect trace evidence which will help you determine the cause of death, which is the main aim of doing the molecular autopsy. Coming to aims and objectives of medical autopsy, first and foremost is to determine the cause of death, how the person has died, whether it was natural or unnatural. Unnatural mainly it will close like accidental death or suicidal death or homicidal death. So it may be there to find out how the injuries has occurred. So how injuries had it was occurred because of naturally or some external force were used for, or because of weapon it was whether it was caused by weapon which was found in the scene of crime. That is also question has to be asked to find out whether what was the manner of death, whether it was again natural or unnatural, whether accidental, suicidal, or homicidal in nature. To find out times is death. This can be determined by postmortem changes which can be seen in the body, like PM staining, rigor mortis, etc. To establish identity when not known. This is mainly done if the face is determined, it can be easily done. Then there is fingerprints is present, then it can be useful. If the face is the skull of the face is not determined, we can go for bone examination to determine the sex, and other characteristics has to be known. Then body findings, cloth articles are searched to determine the identity of the person. Next is to collect physical evidence in order to identify the object causing death and to identify the criminal. So mainly the surgeon will collect the blood, then viscera, some physical evidence like any blood stains if are present on the body, like any sweat, any type of stains are present on the body. Mainly trace evidences which are collected to determine the how the person has died, and to help the investigation officer to collect to catch hold the criminal, to retain relevant organs and tissues as evidence. So mainly cases of like toxicological death, mainly viscera are preserved to determine how the person had died. In newborn infants, mainly to determine the questions of live birth and viability, whether the child was viable at time of death or it was aborted earlier. That is also should be determined in case of infants. To find factual and objective information for police and court. So this is important. Mainly, the aim is to help the investigating officer to determine the criminal who has caused the death and to help the court in determining the decision. Coming to decision. Come to rules for medical autopsy. Whenever the autopsy body is sent for medical autopsy, it should be labeled as soon as it arrives in the mortuary. The autopsy should be conducted in the mortuary itself and never in any private room. Many in cases, only in cases like advanced stage of putrefaction, it can be done at the site, because moving of the body may lose some evidence, so it can be done at the site itself. It should be conducted only when there is a official order is authorization requisition record is there from a police or a magistrate. It should be performed as soon as possible after receiving the requisition without any delay, since many findings will be lost if delay is done. The medical officer should first read the inquest carefully and find out the apparent cause of death, which is given by the inquest in the investigation officer, and obtain all the available details so that the attention may be directed to the specific points, carry out appropriate investigation. Then if case sheet is present of the case has to be examined. This will helpful in many ways to determine how the person had died. It may be helpful to determine nature of the wound, if it is sutured or if the patient survives for few days. For example, if there is the person was stabbed and brought to hospital, he was treated during hospital, then his case sheet will determine whether there was a stab wound was present or not, or whether it was incised wound or whether it was lacerated wound. If it is stab or incised wound, it is caused by sharp weapon. If it is lacerated wound, it is caused by blood matter to determine. Then if there is surgical incisions are done, then that has to be known. If there is any therapeutic wounds are there, like surgical stab wounds for chest is done, like for drainage tube is present or not. Some resuscitation injuries are caused during artifacts are introduced during artificial respiration that may lead to like rib fracture, that is should not be mistaken for accidental injuries. In firearm wounds, to know whether the wound of entrance, which was the wound of entrance or exit, if there was any surgical intervention of done during that time. Also to not to mistake collection of blood in the chest and abdomen to from the operation to trauma. Then areas of intenders for detection of contusions, which should not be also be confused. If head injuries is present, the patient is maintained on respirator lung, which shows areas of collapse and hemorrhage, which is normal occurrence, which should not be confused as pathological or some traumatic injury. To detect fractures or fissure fractures if it is present before death or it may be introduced afterwards. To cause the cause of death, like if the person had died naturally, some diabetes by asthma, epilepsy, anemia, renal failure, etc. Then actual poison consumed, if it is known, if the signs and symptoms are already known, so the physician may suspect some poison. If it is already suspecting, that will be helpful to determine which organ should be helpful in preserving the organ and look for the changes in those organs. The examination should be conducted in the daylight itself as it is required, because some color changes such as jaundice, changes in the bruises, changes in the postmortem staining cannot be appreciated in the artificial light. Preliminary examination can be done if the body arrives at night, and actual postmortem should be done in the next day as early as possible. It should be conducted as early as possible, but though there is no law which prevents the autopsy conducted during night. So if Urgency is there and autopsy is required to be done in night. It can be done with sufficient light. Next rule is the body must be identified by the police constable before doing the autopsy, accompanied with relatives. If it is the body is identified, relatives has to be asked to identify the body. The name of those who identify the body must be recorded. In unidentified bodies, the marks of identification, photographs, and fingerprints should be taken to determine the identity of the person. This should be collected. No other unauthorized person should be present at the autopsy. Investigation police officer may be present. Discrepancy in inquest report and body findings should be reported to the investigating officer. So sometimes what happens, the IO determines that person may died because of suicide, and you find some wounds which look like a person may be of homicide. This has to be immediately pointed out to the IO that there are chances that the person may not be have died naturally, may not die by suicide, but he may be killed. Then, as autopsy is conducted, details of examination should be noted verbatim and sketches made for all important injuries. Nothing should be erased and all the alterations should be initiated to the report. Even if the body is decomposed, autopsy should be performed like such some important lesions like may be found. Both positive and negative findings should be recorded in medical autopsy report. After completion of autopsy, the body is handed over to the police constable. PM report should not be issued to the third party, only to be issued to the investigation officer or police constable who accompanies the investigation officer. Autopsy room rules regarding autopsy room. It should be properly ventilated, illuminated, and cleaned with plenty of running water. Daily cleaning and disinfection must be done. Phenol, Savlon, or glutathione 2% can be used for disinfection. Autopsy care must be taken to prevent unnecessary soiling of the floor, walls, instruments, and splashing of the body fluids and water. All instruments must be washed and disinfected after each use. Biomedical and other materials must be disinfected and disposed according to the Biomedical Waste Management Rules 2016. Universal work precautions should be followed. In many times, if the person has some transmitted disease like HIV, then like hepatitis, tuberculosis, hepatitis, then all the staff members has to be follow universal precautions to avoid getting infected. Next, rules regarding autopsy photography. So photography is essential to recall in case of the person autopsy surgeon to recall the findings which he may forget in case when he is called to court. So this is very important, and photography should be done properly to remember the findings. Main objective is to provide a visual record for the pathologist to refer at a later time, to allow the professionals to review the pathologist's findings and formulate their own opinions. Sometimes the opinion may differ, so other pathologists and autopsy surgeon may review the photography to show the judge in trial what was the injuries, and also it is helpful for teaching purposes for undergraduates and postgraduates for types of injuries and how the case are presented. Photography should be taken from above at right angles. So if photography should always be taken at right angle to the injury, and if it is taken not in the right angle, then even the circle will look like a oval, so that is should be avoided. So if only in case of right angle the injury will look properly, and if it is taken in the not in the with the angle like in this like a 45 angle like that, then the dimensions of the injury will be differ and it will look totally different injury, that has to be avoided. The case number should be placed in the corner or along the edge of the photography. A pointer may be for lesions may be required. So along with the, if there is, for example, this is the injury, then case paper number should be like the PM number dash, then a year whatever is there, that has to be mentioned. Then if possible, if any specific injury is present, then a pointer may also be used to specify the what injury has to be concentrated on. In violent deaths, front and back views of the unclean body should be taken with the clothes, and also afterwards the body should be washed. Then naked body distant shot is taken, then the close-up shot is taken. Mainly is to done to know whether the changes, whatever the changes are present or absent, should be determined. In unknown dead bodies, photographs of the face should be taken. Victim signs should be photographed to demonstrate electrical burns, defense wound, cuts, etc. Ligatures, gags, bindings should be photographed before removal from the body. From photographing viscera, the shot should be vertical to the lesions. So always it should be taken right angle to the whatever the lesions you are photographing. Isolated organs should be cleaned with sponge and placed on the green cloth and photographed. Next, coming to autopsy report, what are the contents of autopsy report? The autopsy report has three parts: the preamble, body of the report, and conclusion. The preamble includes the authority ordering the examination, the what from which police station it was brought, who ordered that, then time of arrival of the body in the mortuary, date and place of examination, name, age, sex of the deceased, then means by which the body was identified as to measure. Then body of the report consists the complete description of the external and internal examination of the body. It includes all the includes like examination of the clothes, examination of body, then afterward internal examination, dissection of the body, organ findings, all is mentioned in the body part of the report. It should contain a description of nature, direction, exact situation, and dimension of the wounds. Number should be assigned to each wound and that are described. Then diagrams are often of value, and each, if possible, diagram of the body should be drawn and injury should be drawn on the body itself. The report should include all the positive findings and all the relevant negative findings. Next, the last part is the conclusion, which draws the opinion of the surgeon. The conclusion as to the cause of death must be given based on the postmortem findings. Conscious and clear language should be used to express the opinion. The report should be detailed, comprehensive, honest, and objective and scientific, and whatever up to his knowledge, the opinion should be drawn and clearly mentioned in the clear words. This is followed by signature and qualification of the doctor. That completes the report. So the first preamble, which includes the name, age, who, when it's brought, then body, which includes the external and internal examination, then lastly the opinion and the doctor's sign should be present. That only then only the report will be complete. These are my references. Thank you.